Hello, everyone. I see there is a very lively discussion. I hope we can have some of that also later in our group work. But yeah, I wanted to welcome everyone to this session. My name is Andres Hueso. I work for WaterAid, and on behalf of WaterAid, UNICEF, and the Sanitation Learning Hub at the Institute of Development Studies, I wanted to warmly welcome you to this event, a very exciting one. We are launching the rural sanitation programming in challenging context guidance, and this is very the result of quite a lot of work over many years by many different people. It started actually in the silence of a UNC conference a few years ago, where some of us thought that we needed better guidance for rural sanitation. This is one of the last pieces of the puzzle that was started then. So it's really, really great that we are having this opportunity to launch it today. The idea for the session is this introduction, and then a bit of background of the guidance, and then going into the detail of the how to do it, how to use the guidance for rural sanitation programming. Then we'll have a bit of Q&A and delve into group exercise using some scenarios so to try to apply the guidance with this case. Then feedback and summing up. So yeah, with that, the first point, the introduction is over, and we'll hand over to Jamie, the Institute of Development Studies.
Great, thanks, Andres. My name is Jamie Myers. I'm a researcher for the Sanitation Learning Hub at the Institute of Development Studies, and have been a co-author on the guidance. So I'm going to start by giving you a bit of background before talking you through what we did and where we're at now. So as Andres said, a few years ago there was discussions here about developing programming guidance for rural sanitation, and this ended up with guidance on programming for rural sanitation being published in 2019. In this guidance, 4 types of rural contexts were outlined. The first was rural remote, the second was rural on-road, the third was rural mixed, and the fourth was difficult contexts, it was called at the time. And the guidance went through and provided detailed guidance on designing an implementation strategy for large-scale, area-wide rural sanitation programming, but focusing predominantly on these first 3. So on rural remote, on rural on-road, and on rural mixed. Difficult contexts were mentioned. However, they were mentioned as being particularly challenging, and that there was a need for specific implementation strategies, including adequate capacity and budgets for these particularly special cases. But beyond that, the guidance didn't give much more information other than that. So what we wanted to do was try to fill this gap and try to provide some a resource for these particularly difficult contexts. Okay, yeah. So the first thing we did with the 3 organizations is try to define what these challenges were. And these were challenges where it was felt that current rural sanitation approaches were struggling to reach desired results. And so based on our previous work, these 5 categories were starting to emerge. The first was extreme poverty and social marginalization. Up here. So individuals, households, communities, and groups can be unintentionally or deliberately excluded and marginalized. This can be due to age, disability, sexuality, ethnicity, caste, and social status, or religious, political, and cultural beliefs and social norms. While those living in extreme poverty may lack land, shelter, finance, building materials, or financial services needed to be able to construct and use a toilet. The second challenging context for rural sanitation programming was entrenched attitudes and social beliefs. So attitudes, social norms and beliefs making people reluctant or unable to construct or use toilet facilities. And these attitudes and beliefs persist despite standardized behavior change efforts. The third was tough physical environments. For example, challenging geographical conditions, lack of materials or exposure to natural hazards. It also includes remoteness, which may hinder access to necessary sanitation markets, materials and construction techniques. The fourth category was lifestyles and livelihoods, which make sanitation challenging. This could be due to a group's temporal, transient or informal status, such as temporary and seasonal migrants, fishing and mining communities, and nomadic or semi-nomadic communities. And the fifth was fragile contexts, so falling both within the development and the humanitarian spheres. These contexts can be challenging due to a lack of access to program sites and the presence and effectiveness of governments, market actors, or NGOs. This fragile context category also includes places where there may lack social cohesion and conflicts within communities. And two additional important points when considering these five contexts is, firstly, though they're presented separately, these are rarely experienced in isolation, and it's really important to recognize the complexities of societies and the lives people lead, with multiple challenges overlapping, intersecting, and compounding problems and reinforcing the status quo. So yeah, it's much messier than these five categories show. The second is that all these categories are exacerbated by climate change. So those living in extreme poverty are more vulnerable during and after climate shocks. Physical environments become tougher, with both excess water and water scarcity impacting infrastructure and deterring toilet use. The impacts of climate change are forcing changes to lifestyles and livelihoods, increasing fragility and tensions, and likely to increase the number of displaced peoples. So, yeah. So what we aim to do, we initially commissioned a desk review to map the rural sanitation approaches and approaches in challenging contexts and the current guidance being used, drawing out emerging experiences and lessons. This was undertaken by Will Tillett, who we're very lucky is here in the room. So if there are any awkward questions I can't answer, I'm hoping he can step in, and Oliver Jones. So for this desk review, they reviewed I think it was 180 documents, conducted 44 key informant interviews, created a repository of 335 different resources cutting across the five challenging categories, which accumulated with us publishing a learning paper and learning brief in 2001. And so drawing on this review, we were keen to turn this desk-based study into something practical, into a practical resource for the sector. So we aimed to provide guidance on the aims of this guidance was to provide information on challenging contexts as part of an area-wide approach, and also not to focus on these individual five contexts, but provide a resource of how people can consider the plethora of different challenging contexts which they may find within their areas. We're very keen for it to be people-focused, recognizing complexity, intersectionality, and the challenges people faced. We wanted it to be practical and user-friendly, and not be an A to Z guide, but provide some direction on categorizing and profiling, conducting formative research, designing implementation strategies, and choosing and evolving different sanitation programming approaches. And then wanted to also provide guidance on monitoring and evaluation and advice on advocacy and influencing policy. So the focus is very much on guiding principles, tips across the program cycle, and recommendations. So how we converted this desk-based study into this guidance. We invited contributions from across the sector, asking people to provide examples for their programming, where their programming was tackling with some of these challenges. We worked with WaterAid offices in Cambodia and Ethiopia to map the challenges with different stakeholders in their countries and discuss some potential solutions which were already being used. We commissioned 11 case studies, which we're also publishing as an annex to this document, and they come from across the world, from Colombia to Pakistan to Burkina Faso, to name a few. And so, drawing on the desk review and all this additional work that we did, we developed a number of drafts which have been through rounds of different practitioner reviews, and we've ended up with rural sanitation programming in challenging contexts, principles guiding questions and recommendations, which we are launching, which we're very happy to be launching today. So for this presentation, for the rest of this presentation, this is the background, now moving into the guidance. We really wanted to give you a flavor of what you can find in there. It's not a comprehensive walkthrough, and we encourage or hope that you'll all be rushing to scan the QR codes, which you'll find on some of the seats, and download it the moment the session finishes. So this is an overview. This is a visual overview of what the guidance contains. As I've already been through the five contexts, but I'll just repeat them for clarity. The first is extreme poverty and social marginalization, entrenched attitudes and social beliefs, tough physical environments, lifestyle and livelihoods in fragile contexts. We then present some principles. We use the principles which were released as part of a call to action, also in 2019, which I'll go through in the next slide, but we situate those for challenging contexts. And then we present different stages of the program cycle, from planning to implementation to evaluation, and learning and adaptive management and advocacy. And instead of providing practical, step-by-step guides, we framed it around different questions which you should be asking yourselves. So you're better considering those living in these contexts. And then we have some recommendations towards the end. So let's start with the principles. So these are rural sanitation programming principles, which were agreed by major rural sanitation programmers. And so the first is government leadership. So programs should be led by national and local governments who display strong political leadership, backed with human and financial resources. The second principle is stakeholder alignment. So strategies and plans are agreed at national and local level and work in a coordinated way, strengthening existing government systems. The second is area-wide inclusive programming. So programs need to be designed to reach all within a given jurisdiction, at home, in public institutions, building on available institutional capacity and resources. The fourth is inclusive and resilient solutions. So striving to understand which communities and individuals are at risk of being left behind, and taking measures needed to address inequalities. And the fifth is evidence-based and adaptive implementation. So programs are informed by context and adapt and combine different approaches. And though all these are relevant for challenging contexts, the fourth one in particular, this guidance speaks to the fourth one in particular. Well, we also added a fifth. We know these places are going to be more expensive to implement in, so we need to move beyond a simplistic cost per capita benchmarking and ensure that we're considering effectiveness, sustainability, and equity of our programs. So some more detail in the section on planning. This is divided into three. There's a component on understanding, mapping, categorizing, and profiling different contexts. There's a section on identifying and engaging partners, and then there's a section on budgeting. And an example question we pose is who may be missing from existing data sets, noting that some people, particularly those who may be marginalized, may be. For example, national surveys risk missing certain groups, such as displaced persons, minority groups, and migrant workers. And few include intra-household disaggregation, such as data disaggregated by gender, age, and disability. It's therefore important to identify those who may not be apparent in existing data sets when planning your programs. And we provide an example from Terra Grata, who use a range of different tools, including social media networks, Google Forms, professional networks and platforms, and word of mouth to identify unmapped remote communities in the Colombian jungle. So using these different methods, they've identified around 80 rural remote communities, none of which were on the official maps, official local authority maps. On to implementation. This section includes designing strategies, staff recruitment and development, engaging communities, and technology choice. An example question here is, do I need to adjust my engagement strategy? And so an engagement strategy may need adjustment if trust of outsiders is low, there are physical challenges accessing communities, or there's current security issues. So all these factors will impact the number and frequency of community visits. So based on the context you're working in, more condensed time may be appropriate, while in other circumstances, you may need to work through community groups and local NGOs who have a footprint on the ground. And we provide a practical example from Self-Help Africa, formerly United Purpose, who adapted their CLTS strategy in 7 clusters of villages when implementing an area-wide sanitation approach in Obaliku local government area in Cross River State, Nigeria. So these particular communities resided in a particularly tough physical environment and required a 10-hour hike to reach. So they couldn't go as frequently. So instead, they undertook week-long trips, reducing travel time, building trust, and providing technical support to communities whilst also while triggering and then doing follow-up. On to monitoring, evaluation, and adaptive management. So in this section, we have designing and evolving monitoring systems and learning and adaptive management. So an example question is, what adaptations may be needed to my monitoring system? So additional indicators or adapted indicators may be required alongside changes to how monitoring is undertaken, as well as how information is collated. And we provide an example from SNV, who were funded by UNICEF to implement CLTS in 9 communes across 2 provinces in the eastern region of Burkina Faso since 2015. And due to the COVID-19 pandemic, as well as changes to the security situation, they were no longer able to visit the communities. So in response, they established a remote monitoring system with community sanitation village committees. They provided them with training on monitoring household sanitation and latrine construction, and they set up a telephone system where they were able to phone SNV, and they were remunerated for the cost of the calls. Then we have a section on advocacy and policy change. An example question here is, how can national policies be influenced to focus on people in challenging contexts? So national strategies often focus on easier numbers and reaching large numbers rather than tackling challenging contexts systemically. So we recommend organizations will likely need to advocate for particular peoples or communities to be involved. So advocacy efforts may be needed to prioritize contexts in sector policies, strategies, national targets, MEL and duty and budget allocation. And the example here comes from the LATEM DAC CONA project, which was implemented by World Vision Vanuatu, who aims to achieve improved health and well-being for women and people with disabilities through access to gender equitable and disability inclusive water, sanitation, and hygiene systems. So the team used project data which they collected as part of their monitoring efforts to lobby the government to incorporate inclusive elements into the national sanitation guideline, presenting their survey results at national sanitation working group meetings with representatives from the government's health and water sector, as well as non-governmental organizations. Finally, we have the recommendations. We have 41 recommendations in general, and I'm going to talk you through each one now. I will not put you under that, do not worry. I'm just going to give you, as well as with the rest, this is really just a highlight, it's a snapshot. So yes, these are just some highlighted ones which I wanted to share with you today. So regarding the planning phase, it's recommended to work collectively with governments, WASH partners, rights holder organizations, and other representatives from community groups to understand what current data might already exist and what interventions are underway in challenging contexts in a given area, as well as consider how intersecting inequalities are impacting already marginalized and hard to reach groups. Some recommendations from the implementation part is design your strategy based on your context and your target populations. Consider what adaptations may be needed to your current approaches. So you don't necessarily need to do something totally new in these places, but it's about thinking through how you may adapt what you're doing in other parts of your areas. Identify what skills, capacities, behaviors, and attitudes teams may need to work with and deliver for communities living in challenging contexts. And finally, consider not just the technologies themselves, but how technologies are introduced, designed, and adapted to these contexts. Then monitoring, evaluation, learning, and adaptive management. Don't rely on data collected from the general population to give you an accurate picture of those living in these challenging contexts. And we recommend to use both quantitative and qualitative data to understand progress, failure, and success, and any negative impacts your interventions may be having on particular groups. And then finally, with regards to advocacy, advocate externally and internally for policies, strategies, targets, mail and budget allocation for challenging contexts, and strengthen, you don't have to do this all by yourself, so strengthen capacities of allies, who could be local civil society organizations, rights holder organizations, or the media, who can help you with advocacy efforts for inclusive service provision. So that's just a taster. Before I stopped, I just wanted to acknowledge the variety of people who've contributed to this. As I mentioned, Will Tillett and Oliver Jones wrote the initial report. We've had a core group working on this, which includes Maya Igarashi Wood, Ada Oka Williams, who was previously at WaterAid and now at PSI, Mike Nilo and Bissi Agberimi, also at the UNICEF, and then my colleagues at the Sanitation Learning Hub, Naomi Vernon, Stacey Townsend, and Rue Hill, Aya, a range of case study authors and a range of reviewers who have also contributed greatly to this. And then this has been funded by the Swedish Development Cooperation Agency. So thank you. We can have some questions. For those online, there is a Q&A. I don't know if there are any people online. I can't.
Are there any questions in the room?
Thank you. One of your points was not to rely on data from the general public. So what are the data sources that are reliable? Because we talk about community engagement and participatory approaches, so.
No,
building your data.
I'm suggesting you need to, then there needs to be other data sources for these particular groups. It could be data which are held by other organizations who aren't in your traditional, who aren't the traditional WASH partners. It could be collecting your own data and using the correct way of the correct level of disaggregation, so we could get a better understanding of people that could be doing additional bits of formative research with particular groups that we know are challenging, but not extrapolating the general, the data from the general public are not going to give you an accurate representation of if we're reaching these particularly challenging groups.
So just to clarify, the challenging groups and general population different in this scenario.
So not using the general population
Yes,
data.
the non-challenging context data.
Yeah, sorry.
Context data to
That makes more
extrapolate
sense.
findings for the challenging
Sorry.
context.
Thank you.
Among the experiences of the implementing partners that you discussed with, did there seem to be sort of a baseline difference among those who had begun with on-road or simpler to reach populations that had reached out to these more challenging locations versus those that might have begun working on sanitation with the challenging populations? Did the learning curve seem to be easier in one direction than the other?
It's not something which has come up. There's very limited experience of considering these different challenges and using an area-wide approach to tackle it. So a lot of this is kind of new experience. So it's not things which there's a huge amount of experience or long time experience to look back on.
Yeah, hi, I'm Meka from Indonesia. In your case, is there any case of challenging in urban context?
So this was deliberately looking at rural sanitation. So we haven't really looked at urban.
Okay. If there's so, in the principle, you mentioned here about the government only, but in reality, maybe it's not in the Indonesian context. In reality, government is not working well with the informal leader or outside leaders. So I think you need to consider to put them also in the principle. Thank you.
Thank you. I think you need a microphone, so if anyone was online, yeah.
Thank you. Thank you for the presentation. My name is Maraya. I work with UNICEF. And actually the question about rural and urban triggered me to ask this because I've also worked in contexts where what the government would consider as rural, we would actually consider as an urban setting. And so how did you classify rural? Because from this, it looks like it's mostly like really remote, but I do think that we could see the challenging contexts also in like more urban type settings that are still classified as rural. So I don't know if you've thought of this. I know maybe it's going too deep into the into this rural urban discussion, but I think it is really interesting because a lot of the marginalization and the poverty actually is also in those contexts. Thank you.
I agree. Like we were looking at predominantly rural districts, those who aren't necessarily covered by a municipality. So it's more, but just let me go back to the slide. These challenging contexts, these will also be found within here as well.
Yeah.
So it's not just rural, remote. That's just one example. You will have tough physical environments in peri-urban, in rural on road, and rural remote, which makes it more challenging.
So how does it apply to those? Like just
No, it does. It
does
does.
not.
I think this was just try to demonstrate that this was a fourth category which wasn't covered in this initial guidance. This will cut across
okay.
this.
Yeah, it's helpful.
Thanks, Jamie and Brazil and others for the application. I'm Rachel from Tier Fund. Just noting that fragility often means there's a lack of a responsive government, and a lot of your overarching principles talked about working with government. So do these guidelines acknowledge and give some recommendations for when the government isn't playing its role?
There is a section on advocacy, which looks at both national and subnational advocacy efforts which might be needed. We get the principles up. It's designed for people designing rural sanitation programming to think through. Some of this can be done with government, and a lot of the time, as you say, it can't be done. Some marginalized groups are deliberately excluded by government. So, I mean, there is a balance between, yes, try this, but there's obviously going to be circumstances where that's not possible. Okay.
Hello, I'm Mary, Center for Law and Justice, Pakistan. Very happy to see that Pakistan was also part of this study. I think what you were referring to, I'd like to, at some point, I think we also see that even in metropolitans, large metropolitans, there are informal settlements, very similar to what we see in villages. And even within rural settings, there are segregated neighborhoods of the most marginalized people. So they are right outside the village, at the verge of the village, and who are more like outcasts now, belonging to any ethnic minority group, maybe. So did you find something related to it that, I mean, of course, they must be excluded from the development agenda too, but were there any settings across regions you covered?
I don't know the details of all 11 studies, but we definitely considered those as part of as one of the kind of poverty and social marginalization was covering those people who were both physically marginalized as well as marginalized within communities. So that was what we've tried to do is to provide something which enables people to think through, is a series of questions which enables people to think through how they might better serve not an individual context or to say, oh, we're struggling to deal with this particular marginalized group, let's go and use this guidance. It was very much like, how could my area-wide program factor in, implement, and monitor what challenging contexts may be found within my area. So it's not that level of detail to say that in that circumstance you should do this, and this. But these are questions we should be asking, and hopefully it will lead to stronger, for better planning, implementation, and MEL for these contexts. No, that's okay. Will had a question.
Yeah, thanks. Yeah, and just awesome to see this progressing over time. Look forward to collaborating with it in our work in Nigeria. I think just coming back to your point, Rachel, about the fragile bit, and also about the kind of whose data sets, if not government data sets. So we've got quite an interesting program looking at adapting approaches to area-wide sanitation for fragile contexts in Nigeria, that's hopefully going to generate some useful learning. I think it's really about, well, in these contexts, humanitarian actors become that much more key. They're part of the solution, part of the problem as well. And they may be sort of non-traditional sources of data in terms of displaced people and things like that. But it's also about kind of is there an area-wide approach with the humanitarian law, or is it very piecemeal? What could be adaptive approaches for engaging, coordinating, and aligning with the humanitarian actors, even trying to help the government to be a bit more coordinating in a context where the kind of humanitarian actors maybe kind of standing aside and we're getting involved. So I think with all of these 5 topics are super interesting, and as you say, like there's so much kind of intersectionality between them. The fragile context one for me, is really where we start looking at this humanitarian development silos and trying the need to break that down. And when we start looking at that, working outside of that comfort zone as primarily development actors, that's where we start thinking about, okay, we can actually start finding some solutions.
John Allen from Oxfam. On the tough physical environments, curious if there was any sort of innovation gaps that that you found as far as it could be physical products for sanitation, and did any of that come out in any of the different types of tough physical environments?
Yes, nothing very cheap, which is a massive issue. Well, we have the technologies, they just are too expensive to.
Sorry to ask another question. When you were speaking, I thought about issues around exclusion of certain parts of the community or certain groups, and linking it with conflict. And we know that, you know, water could create conflict. Maybe issues around sanitation could also be linked to conflict, and generally I can see conflict is somehow part of this. Especially looking at fragile context. So did you look at things around conflict risk assessments or any of those tools, and did you use them to inform the guiding questions? Because I think if you go into a community where certain members are excluded on purpose, you know, you can put yourself into maybe a difficult position, and it could pose risk. Maybe even to you as an organization or as a person who is intervening. So I'm just wondering, like, is there anything that addresses the potential conflict when you would do this work, or before you go in to understand what are the risks?
No, that's a really good point. A potential annex.
Yeah.
To include, particularly around do no harm and.
Yeah.
I'm happy to take more questions if there are.
I was just specifically on that point, it's something that this study within Nigeria is looking at, is how can you take kind of conventional approaches like MBS and CLTS and then adapt it to conflict charged, very sensitive and displacement communities, and how do we look at that? We had a really interesting workshop at the state level in Benue States, where we were like, okay, so here's the CLTS approach. Here's the context. What's going to happen? And they're like, no, that's not appropriate. That's not appropriate. That's not appropriate. Triggering this kind of context, bringing loads of people together. Well, they're going to get scared. They're going to get attacked by blah, blah, blah. And so actually, there's a huge amount of need for just kind of contextual understanding, doing some of that conflict analysis at a more macro level, generally, but then trying to do that for each and every community, because there's going to be different dynamics, particularly with this sort of displacement conflict. So what we realized is you need to do the kind of higher level assessments, which give you a good idea of some of the issues, and Jamie, you've been involved in some of that. And then kind of what do we need to do during things like pre-triggering and things, and what do we need to our community level facilitators to understand the risks of doing harm, and what are the specific additional barriers that may not be what we normally think of. And so I think it's all around kind of understanding the potential issues, doing some assessments around that, and then building that micro level assessments within the implementation process. But it's really hard.
We have an activity for you, so you can start thinking through some of these questions. Any final question, or should we move on to your work?
Quick check online.
There's nothing online. I've got the.
Great.
So what we wanted to do was to give you a kind of taster to try some of this, to start reflecting on some of the questions which are phrased in the guidance. So we've created a scenario-based activity, and the idea is in groups to read to firstly read through the scenario. You all have the same scenario. To decide what context or contexts you might be dealing with. We have a list of questions which we're going to ask you to work your way through. And then we're going to ask you to decide. We're not going to ask to feedback on your answers to all the questions, but we wanted your feedback and reflections on any interesting points which were raised during your discussion. So we have about 25 minutes, I think, for this. We have four facilitators. Can you make yourselves known? Yeah. And maybe we just head to the corners and start working through it. Yes, we have.
Yeah.
So we have 1, 2, 3, 4, and just try to make an equal number.
Do you want to join? We have a few, so I'll have to share, so we just let them around and then you have to. Thank you.
I like how you wrote.
Didn't even notice.
WaterAid, we need to scratch away.
I go over there. You knew how many people gave the stuff? Hello.
So yeah, while we read the scenario, is there anyone who would like to volunteer to report that?
Yeah, I've got a notebook.
Yeah,
Thank
you. For volunteer.
I would say Lindsay, together. You need one?
Yes.
Copies of the. Are there more copies we have?
Sorry, I didn't realize.
4.
Let me put something up on the screen.
Yeah, just put the scenario on the screen.
I have to use it online.
Maybe the guiding questions is useful, yeah. Yeah, okay, yeah, and you don't have to choose, I think, we can just pick as many as we feel on to play with the scenario. Okay. So think about that.
Yeah. Are the context that we're all reading the same one.
Well, everyone is saying. It's quite straightforward. Okay, so, questions about the scenario, otherwise we could start with the first question. Yeah, okay, so, which context out of these 5, when you think are, in the scenario, once you recognize.
I'm thinking intentionality exactly, because of the previous identification by men. School environment. Yeah, and then projects, because it's in camps, really camps.
Yes. Any other thoughts?
Perhaps poverty, because it's been 2 years since the Alliance people have been moving back, which would suggest they don't have enough resources to rebuild.
Yeah, very good point.
Poverty, living in the country for such a long time now. So economic opportunities.
And maybe there were farmers that have lost their.
Yeah.
So maybe. To a certain extent, there was some that others, but it's a good mix of scenarios. Sorry, these countries. So now if you could then think of designing a program. That we could be thinking of when we design a program. And it was great.
Yeah.
So I think
So
it's.
it's kind of something really
Trying to see how we can answer that. Yeah, these are the right questions to ask also, you know, feel free to. So in terms of plan.
Initially, there was a woman.
So in this scenario, but in such a existing sources of income, I just think that
They
it's.
found something all of here.
There will be some records that might not be necessarily up to date, but you could start there. For example, population of the districts, for example, in Harassur, how many just after the election, there was most likely people registered in the camps. So you have an overall population of where these comes, why this comes there. And now people have moved some of the knowledge, so it will be better. To start with the government records, maybe NGOs, some relief agencies records.
Because there were schools and healthcare facilities, so there were definitely government records, right? You have students enrolled, their families registered. You're gonna have a good source of, at least before the floods. Maybe triangulate against how many are still in camps, who's moved back, there's probably updates around that, there's people been able to move back.
Where are the nearest?
Then also the doing the response. Most it was 2 years ago, at least their partners were working there and they had a different. And also maybe there are still some partners who are still working there.
I think most of them have left, so.
No, that's an assumption.
No, I think it's just here after.
Well, the relief
large
partners have left.
Actors don't know, look at president, so humanitarian.
But there could be development partners that have moved in, right, to transition from relief to.
Yeah. So that would be.
Because now initially it was an emergency, it's like there's still some partners who are.
And might still.
And there's often reconstruction, you know, kind of rebuilding money that comes in some buckets and so.
Humanitarian.
It's not mentioned in the scenario, but.
Yeah.
People
that was after about relying on the lists. You know, if you rely on the list, you down and.
But they're hoping that. And they're not.
Families named on the list, so they get this towards.
In terms of the information right now, we as is wondering if maybe there's floodplain data or work with existing data.
Thinking about the goal, but we have thought of the environment.
There is definitely some GIS resources, like satellite pictures, analysis by like really and so on. Will tell you maybe right now the population density of this area is.
And it's probably not the only river in the country that's flooded, usually it takes place in multiple locations, so. As actors, national and subnational deal with flood response of both the government and partners. And then because of the sort of behavioral thing around open defecation pre-crisis, they were quite possibly government or non-government working on that, who have the approaches and past history in sanitation, or what is effective in sanitation before the.
Like, even if they're not formalized, like just knowing whether it's like historical stream flow or just like how often the flooding like occurs, because from what it sounds like, it like is more common in this area. It's not just like one devastating flood that happens like out of nowhere. So like knowing whether it's like formal historical records or just like oral records of like what has been done in the past, or like how the community has come back if they have similar. That would be awesome.
The reality is there might not be much existing data left.
True. Yeah.
Right? Depending on how big flood peak, so that will be a context there.
And then looking at climate selection going forward.
Often if it's like really
And also, I would like to the issue of data, because I think it's only 30% of the people affected. I mean, it's the 70% is around the population, but they still have the data.
Often after floods like this, there will be like fireman or something like that. So you're going to be some initial data. Give you an idea, but then you don't necessarily know if people have started.
Actually, to build on your point, what was the sanitation infrastructure before? Was it mostly toiletries? Were there access, was it septic systems in the villages? Was the institutional sanitation plan? You need to know what you're gonna have to either rebuild or move on from.
Percent is literally in this case, like, you were saying, what's the data?
Like the societal side of like, like even when we're floods were not, that we're still practicing open defecation, so even if the systems themselves like in theory worked, like obviously society, there were issues of like their implementation. So kind of like putting that into account as well, like making the cultural change or like.
Even within sort of the emergency toilets that were put in place for these, you know, we need the information to find out, but were only communal toilets built in the immediate aftermath, and that's the only was put in place, or did they do communal toilets for 3 months and then start to build multiple toilets? And also, some of the same date, we don't know, but we would.
That might be relevant to the usually partners, like maybe the yours partner is the cluster that they're gone now, but like partner maybe while we're there.
What about the county?
Find out what they did together and so
Yeah, we need to have.
The second question, how do the challenges intersect,
Exactly,
right?
so.
So partnering, they both produce.
Just what on the issue of behavioral change, they're saying before the flood, open execution of started. Even when the Ratima was started, the system using the change.
I think
Even if when the Ratima was available, the stakeholder now, so it means there is a lot of behavioral change. So that issue.
Any thoughts on the challenges?
Yeah.
How do they?
Yeah.
Does that mean everyone has, because whoever we are.
Yeah, the big question would be, does the government want the settlement to exist? Because that's the big question.
The informal settlement, I guess, is not funding, but then people are also not able to go home.
So why are they so bad, right? Is it the livelihoods intersection? Is it?
Conflict is that.
Correct.
Or is it?
Is it economic? Is it simply just a question, they don't have the resources to rebuild their own So the camp is at least giving them food and presumably a level of health and actually with the kids.
We also don't know how long those floodwaters sat, so they're already.
So there's typically a entry point.
Yeah, maybe don't have, like farmers, don't have things going that to go. I think it's something like we're like, who's involved in, what do they do now?
I mean, it's development agency or government.
Livestock.
Yeah.
Yeah, there's all kinds of. Yeah.
And fear of going back.
What if it happens to them?
But lack of options to go somewhere else, maybe that's, yeah, the whole kind of identify the partners, try to identify other pathways.
Yeah.
To kind of, it might not be for term, it could be for other productive engagement.
So given these like different connections with other sectors. Potentially be our partners when we design a climate intervention. Yeah.
Government, local NGOs, I'm sure there's a very active, we'd like to think there's an active kind of civil society and CBO network. You'd want to be part of that.
Yeah, we're a faith organisation, so in many contexts, we need to go to the church or the mosque or all of those. Who knows, all the blood during the flood.
Yeah. Yeah, it's kind of the.
I think, as I said earlier, that it's kind of like reaching out to Texas. Development stuff, reaching those actors who were involved in the immediate community response, asking them how that went, and what they implemented, and trying to see what they did.
Yeah, I mean, the transition of humanitarian assistance to development assistance is not easy or smooth or in any way, shape, or form mapped out. But also, I keep thinking about the intersecting ministries, right? It's like, this is also a ministry of health challenge, it's a ministry of education challenge, it's, you know, it's usually a local kind of, environment, agriculture, all of those. It's a sanitation challenge, but it's really a community health challenge, right? So you've got to look at all the kind of intersecting services and support being provided and, you know, organize more assistance in that context.
I think it's important to talk to like the community members that actually want to stay or that actually like are, you know, in the position, or even those that would want to move back if it were like better, you know, and what that would be for them, what their idea of success is. Like, you know, if it's, they feel unsafe because, you know, of the infrastructure there, or they, you know, feel like their livelihood, like they can't, you know, profit off their land anymore, like what would bring them back, or what would make them feel more like secure back in that.
Very important. Really, but then they, so the objective is.
Certainly after the Sanitation tsunami.
Everyone,
You know, the government actually put restrictions on, so you couldn't actually go back.
So yes,
So we're making assumptions that those that have gone back don't actually.
kind of come to you for that.
Are allowed to.
And then.
Actually, no, the government recognises the dangers
Right, yeah.
of being located so close to the river.
Segment or understanding areas and labels.
The government just want them
And then start tracking all the.
pressure them to work the solution.
You cannot go back in most maybe the areas where the flooding occurs along the river line.
This is planning conflict.
What is that?
Yeah, in many cases.
It's before you go into planning, but it's after.
What is the flooding zone? That's what is the flooding zone, maybe even some of the areas, the land was clear. It's nowhere for them to construct a house.
Your content is really important. Because if you have.
Sometimes there's, so this is like central government advocacy platforms, like on coordination platforms, so you can reach back to those. To try to dig into maybe some of the, there might be policy decisions behind the current situation and try to influence on those other levels. Even while you're designing a local program, you want to work through like a national coordinating body.
And that brings me nicely to the part of the state.
Yes.
Like, you know, what is it like? Like you need the partners. Yeah, exactly. Yeah. So should we move to the sanitation question? Right, so the team itself would also need some capacity support.
I mean, to your point, SBC, right? We want to make sure that there's SBC capacity on the project team.
And also, we are living on the water. Because now we are living in camp, we don't have much change. Because they are saying they are still resistant to use of such change, so the bigger is, they might be outbreak of water utilities.
Again, going back to humanitarian responses, I've been involved, the staff are involved themselves, the staff were impacted themselves, or else you bring staff from outside the area in, and then they have to get familiar with the context and. I think they're hearing about action with staff, made to that support these ones.
We may need the capacity that, there could be a thing where, so the toilets that don't function, is it matter if they're totally irredeemable? Or is it, broken doors that where people don't want to use them, it's down privacy. So we may be working where some emergency toilets need to be put into repair as a short-term intervention, but at the same time, there's work on more sustainable start forwards. And that's going to require different capacities.
I think they are saying who are still using toilets even when they were available. But I think it's mostly the behavior shift. The things are there, but they don't want to use them.
So really a balance makes sense. Even in those informal settlements, the big environment that are actually functioning, maybe train people to how to fix their own toilets. So yeah. The technical change, or they considering where they're from, if they have been and I guess also depending on your planning to see this setting, you may also need to reach your staff if they're doing like the regular NCHS work, then it may not volunteer, so you need to rethink in a strategy.
That's a good answer, but this government had a CLTS strategy with no subsidies. But after the earthquake, they did have to go back. If I've not previously had a military that they had built, they could be provided.
Also, the
take that flexible approach to.
So maybe something around self-help groups or microfinance, something like that. Think of water. Bring that in. Sanitation. There's no market.
They need a home.
It is also the staff need to be trained on the issue of disaster preparedness. Because maybe when we are still living in fear.
Yeah, I think that for me, this question comes in very early. If you haven't decided what you're going to do, you have to already decide how your team has, like, I feel that it's. Anyway, yeah.
We also don't know where this district is located, so we don't know what type of toilet this community has, so. It's a little train, train. That makes it. So how can we incorporate that education as we maybe build these toilets? We can do our tests, show the. Great.
I guess it's a step back and one more time to like the exercise. They want us to.
The next one,
Doing exercise.
staff behaviors, their impact, organizations. I mean, it's listening to what you said, like they're from there and from experience that, or maybe even they have family members who would advocate.
Yeah, make one up. Go for it. Where are they?
Saying we just basically mentioned
The behaviors of.
Yeah.
Not just in challenging ones.
But yeah, there, to your point, I think there might be special kind of internal training after doing our sensitization. Again, probably this sensitive approach, right? You're in much of a different context than your usual kind of programming. So that's, this is a new context for your organization. So you want to make sure that everybody kind of understands that you need to.
Maybe it's different. Organization staff from a student house.
You might not be able to do that.
Different apps and the community and the
And not just cats, different tribes, different regions, I mean, there's lots of different social strata.
Exactly.
That can be at play. Right, yeah.
Sometimes spending more money on developing a stakeholder.
Male, female,
Sort of moving the box down, and often we found that this problem of sanitation services in Kansas City was very pervasive. And we suspected one of the causes was one factor was an underlying difficulty in establishing empathy between staff responding and then the situation of somebody in a camp. So someone we worked on was creating the training, but it included a video interaction around putting yourself in the shoes of somebody who is in a camp. But then specifically beyond that, somebody with a disability and comment and so forth. And so these sort of empathetic tools.
I also really liked what you said too, because assuming, like, I think a lot of this is outward focused, like if you bring people in, what their attitude should be, but also if you have people from the community that are working with you, like, you know, they could be people that have lost their whole lives, like their whole, like, you know, the mental health aspect of that, or like, you know, watching a community that you maybe grew up in and now it's nothing. And so like having that support internally as well, like both with, you know, with outside people, but also with people from the community, making sure that you have that support in place for like, you know, actually rebuilding, but the process of like kind of mourning what used to be as well.
Right, so we already. And how do you think we can build trust, engage?
Because you already have some infrastructure there, so we part of the assessment is what's there, what's wrong. At the end, what can we fix?
Alongside with the community leaders.
Yes, I mean, to your point, kind of employing or staff marginalized yourself, saying that, you know, you're working with a lot of people with disabilities.
We'll come back in a couple of minutes. So do people want to start thinking through some of the interesting, what have I, how do I put it, interesting things which have emerged onto the interesting points which may have been raised or hopefully have been raised through your discussions.
I think to your point, that trust and credibility, because this is so fundamental to all of us, right? But it's a challenging context or not. Part of it is just, again, over time, being credible. It's how you build trust, right? If you engage in it, in that open way, and you listen and you're comfortable. Some of this is transparency as well, right? Yeah, and accountability.
This is what we want to do, you know, and the accountability.
Yeah.
But I cannot do this.
Yes.
Felt that these. Like. Agency showing exactly. How we're gonna go about.
And then when you're doing a survey.
Also, I'm not sure if you said about participation, like, okay, so what does success look like for you? What do you go back home, where we can, things like that.
I think also meeting like immediate needs, often in these settings, there's like.
kind of
Means we'll
works.
see the same thing that night girls and girls do.
Then you.
So meeting in the community and then talking about water.
That is right, but specific.
Well, summarizing.
So fun.
Yeah, because we have to summarize three things we found most interesting and gender.
Yeah, we're just understanding like segmenting.
Some of the ones I wrote down was,
segments.
about the information that we might be able to start
And
with
also
and the timeliness
understanding
of that. So there may be things that are still relevant, like get information on floodplains, but things that in the movement itself can drastically change. That's very good. And so that will be more or less. And then the transition, like we talked a lot about the kind of implements and the transition between an emergency response and then coordinated there as possible and, you know, make sure that their stakeholders are able to then the other one I marked is, you know, trying to spend some time on investigating why we are there. What it means for recipients for like infrastructure work. And that's maybe it's different kind of stuff, you know, infrastructure, like people things to bring them back to another area. And then finally, I did mark that as training us for staff. I thought that was amazing. Yeah, those are my main summaries. If anyone has anything that they want to highlight.
Is also
Yeah, like an disaster response.
The observation and the conversation, right? I mean, I think what's continues to come out to me is that the fundamentals of our development assistance remain the same. Whether it's a you know, you just adjust your approach a little bit to contextualize it, but it is about well-trained staff, the right approach, trusted relationships, you know, evidence-based interventions to the greatest extent that you can, but recognizing where there's gaps, you've got to find ways around it. And work with our trusted partners. So it's really interesting. I think it's more recognizing where some of the normal implementation modalities are different because of the context, right? Conservation of this country.
30 seconds there, and we'll report back.
Yeah, there's gonna be pockets of challenge in every area. Of work. Yes, yes, it is.
The key thing about water is, this is sanitation.
So about sanitation, the water stuff.
Okay, are we ready?
Do you want us to go back to normalcy then?
Having our.
Okay. Who would like to go first? So just some key reflections or interesting points which emerged.
Yeah, great. So some of the key findings from our discussion, first, we talked about the information that we might have. Yeah.
Are we ready, guys?
Thank you. Hi, everyone. I'm Emma Kelly. I'm from the Water Project. Our group had a great discussion. Some of the key takeaways. We first talked about the information that we might have already. And talked a lot about how some of that information will have changed a lot due to the movement of populations like census data. But some will be kind of more true or more kind of relevant even after the disaster, such as like GIS information on floodplains and some of those geographic features that maybe didn't change. But the movement of people makes the use of prior information very difficult. We also talked a lot about the transition from the emergency response to the kind of reconstruction development response and how that can be really tricky. And that informed our first person to partner with or stakeholder to engage would be the previous cluster that was working on the emergency response to try to have a really productive and intentional handoff between those emergency actors who have mostly already left the scenario, but to make sure that we understand what information they were able to collect, what they were able to accomplish. The other thing we talked about was kind of why people are still there after a protracted time, who wants to stay, and maybe the government doesn't want them to stay, who maybe wants to go home, but that area is no longer safe, and what are the dynamics that are keeping people there, because that will really affect kind of whether we want a heavy infrastructure type of response or something that's a little bit more social and adaptable, which I think we emphasized in our implementation plan, behavior change. That way, if people wind up moving, that kind of information goes with them. Disaster preparedness is a key component of that. And because there was already entrenched behaviors, ODF, that was already happening beforehand, that the social component needs to come first. Finally, we kind of said at the end that the fundamentals stay the same. And we saw in our conversation that really building trust with the communities, training your staff well, and essentially doing your work with intention and integrity is relevant for all contexts, and especially when you're working with marginalized groups or in difficult contexts.
Thank you.
Hello everyone, I'm Prerna from WaterAid. So our group, I think one of the very interesting things was we wanted to understand the context very well. What kind of setting is it? What kind of places is, of course, the camp is there, but what about the neighboring areas? As you also mentioned, right, there's some people who must have left, but then there are people who are left behind. Why is it that they're there? How many of them are there? So a lot of questions around the context itself. So when we're getting into the planning stage, we need to have a very good understanding of where we are and who all are there. So that was one of the key takeaways, at least I think our group had, that we need to have a very good assessment when we're trying to do planning for any kind of interventions, whether it is, again, also trying to decide, right, we would say area-wide sanitation, but what kind of resources are there that's available to us? Whether we want to take an approach where we are just focusing on these marginalized, fragile communities or spaces, or with the limited resources again that we have, we focus on the camp, but also maybe the village, on whose vicinity the camp is. So it is also trying to understand the resources, again, in terms of finances, in terms of people, in terms of capacity. And a lot of it has to do, of course, with the community that you're working with. So what kind of, again, behavior, because what we've read here is that men usually do not like to use toilets, right? But we do not have, again, a lot of context about women, about children. So again, all of this also feeds back into our monitoring system. So again, picking up indicators, trying to understand how a monitoring system should be framed, that we're able to collect data, information on the right kind of indicators, which can feed into our planning, which can feed into our implementation. A lot around that. Would you like to add anything else? Yeah, and yes, reiterating what you said, we need to, of course, work with communities, we need to work with a better understanding of the cultural context. So yes, a lot of work around community participation and engagement.
Great, thank you. Round of applause.
Thank you. So yeah, we had also lots of similar discussions about the question, but just to summarize some of the overall reflections about the guiding questions. One that we thought was quite useful is the question on the intersection of the challenges and even the having these 5 categories that shooting where does this one fit? And we felt it is like a useful way of nudging teams to interrogate a bit more and to understand the context properly rather than okay, let's go here and do this or do that. I will do that, but I know that what exactly are we dealing with in this context. The questions also helped make some principles. For instance, we talk about do no harm, and it's like a very, can be like a very general thing, like yeah, we do not harm. But then when you are asking, okay, what attitudes do your staff have that should be detrimental, then make it a bit more tangible, basically, to have that. Another reflection was that the three questions that are included for implementation are actually quite relatable in terms of if you have if you, I mean, to be able to operate properly in this context, you need to make sure that the staff has the right attitude. So the staff think they know it all and they could give a silver bullet and probably won't work. So you need that attitude to be there, but also the capacity to then be able to engage with a much more complex context and set of or a dimension that you need to address, like behavior, displacement, etc. And then how the trust is really critical to be able to connect with the communities and try to understand those dimensions and learn from them, etc. And then final reflection that we had is that the exercise is very useful, but we would hope that we would then try to intervene in this context with a sanitation intervention. Because we see like there is housing, displacement, etc., that will require a much more holistic intervention and then sanitation. That okay, if people are being relocated, then this is how we design sanitation, or if people are staying, this is how we will approach sanitation. So that's it. Thank you. Thank you.
I think following up on the other group, we talked a lot about trust as well. And one of the things that we mentioned was going in knowing there will be distrust because they've been abandoned by another group already. And so you're already going to be starting in this atmosphere of distrust and trying to build trust there. And so just acknowledging that process will take time. And that is an important step to any type of intervention that you're going to want in this community. And also thinking about trust was also this kind of idea around transparency of how do we exit? How do we not abandon the community? What is going to be that process for us leaving? Because we're not going to be able to stay there forever. And so from the outset, setting up those expectations of what we are able to do in the community, how long we're going to be able to be there, and how we're going to leave. But that led to another idea of building capacity. So we talked about building mutual capacity, not just capacity within our team, but also capacity within the local community. And so having a holistic team that supports all the needs, mental health,
engineering, social sciences, and then building capacity within the community so that they can continue on whatever is put in place. And then the last point that we had was changing attitudes. So it was mentioned in there, you know, we have this attitude around men practicing open defecation, and that's something that we want to be addressed. But it, again, acknowledging that attitude change is a slow process. And so building into the process that maybe in the time that you have there, you're not going to be able to change the attitudes, but you can begin laying the groundwork for that behavior change to happen, and you can build a capacity for the behavior change to happen down the road.
Great, thank you. I think that gave you the presentation and the exercise gave you a flavour of the resource. In the last 5 minutes, we just have some time for a quick summary. We do have Bissy from UNICEF online, which we're going to try and get hold of. But first, I wanted to ask Na from USAID for some.
Oh, you want me to come?
No. You didn't. We can be informal. Just some reflections on the resource and how you think it could be.
Yeah, I was looking at the resource last night and it's actually congratulations for making it not so big. Right?
30 pages.
30 pages. So it's not the WHO guideline. Different kind of document. I did find that because I think you were trying to synthesize up and provide a concise document, I did find the recommendations to be like somewhat general. I found I think that practitioners will get the most mile out of looking at the annexes and the country examples. Because when I looked at that, I was like, oh, so I think SMB provided some flexibility in the budget for something. And I thought, oh, USAID terms, crisis modifier, right? So I think there are tools. I think that when you read about the examples, you will say, oh, could we potentially do that in our organization? Is that replicable? I think my feedback from this exercise is that it's really complicated when you have a scenario that is of all 5 categories, right? There's intersectionality between all 5 categories. And my takeaway was that is area-wide wash the solution? Is it the first solution? Is it the entry point for solving all of these complexities, right? And then I was thinking, yeah, so what would I do in thinking about problem analysis is that I would reach out to my economic growth offices. I would look at my agricultural advisors or colleagues to see like really foundationally we can address wash, but I'm not sure that it's necessarily going to address a root cause. It is going to be a symptom because they don't have facilities in these areas. But I think that really we do need to look for these complex situations to address a more complex problem that goes beyond our sector.
Thank you. And let's see if the tech works. Bissy, can you hear us?
Yes, I can hear you. Can you hear me?
Ah, yes.
Yeah.
I'm surprised.
Excellent.
He put you on the screen as well so we can see you too. Here we go. Live from New York. You're on the screen. Do you want to give some reflections?
Okay, thank you so much. I think this has been very interesting. I've been following with keen interest. And from all the discussion and engagement, I think for me, or for us, UNICEF, we think this technical guide is a product of extensive research and consultation. It took us such a long time to really agree on some of these principles and discussion. Even the case studies, I mean, we had a very elaborate discussion on this, and we're so excited that finally this technical guide is being launched. And for us, we think that the technical guide will help to enhance our capacity and reinforce equity elements of our rural sanitation programming, which align with human right to sanitation, because often this category of people are often left out. So the whole idea is to further expatiate or support our inclusive and equitable programming to ensure that these people are reached. And we believe that for us, the technical guide complements all the existing guide documents. It can't be alone, definitely. We have to, it has to be combined with other documents or other guidance. Especially for us, we have the UNICEF game plan on reaching settlement sanitation. We bring this additional resource that can help our country colleagues to move the agenda forward. So I think this is extremely very useful for us. And we plan to disseminate this through global webinar, regional and country level webinars to further ensure that this document is used at all levels for programming. And I mean, reflecting back again, I know it's complex, but we don't have any excuse for not having equitable and inclusive programming. We don't have any excuse. And for us, I think it can no longer be business as usual. We know we still have a long way to go in terms of enhancing our capacity, mobilizing action, inadequate resources of financing for us to really turn to action some of these things we are talking about. We've had a lot of case studies talking about additional resources, both financial and time, required to reach the unreachables. So it cannot be business as usual. If you want to still continue to plan your programming without making adequate provision to reach these unreachable people, then the result will be the same. But we feel that with this technical guide, it will really help us to have a rethink and kickstart actions on moving this agenda forward to ensure that we reach the people living in challenging context and further enhance our rural financial programming. And of course, this aligns very well with achieving the SDG 6.2 target, which is far away from being achieved, but again, we have hope, and we can only move near if, again, we incorporate all these principles into our programming. That's why I say it can never be business as usual. If it's business as usual, then we can never get it done. But we have to start with changing the mindset, putting adequate resources, and making sure that all people are reached with safe sanction service. I think that's very important for us. So for all these are exciting moments, and this is the beginning of discussion, it's not the end of it. We're going to have a lot of follow-up plan, follow-up discussion to ensure that the technical guide are fully incorporated and fully used in our rural financial programming. So I thank you so much for your active engagement, and you have a nice evening. Thanks so much, over.
Great. Thank you everyone for coming. Have a good afternoon. Thank you. And just
Yeah, they love that was one.